Hi, welcome to Case of the Day. Today is Wednesday, case 78, and it's titled Looking at the Sagittal Spine and All CT Chest Reads. So I was reading this case today and I thought it's important that we talk about this. So the 68-year-old came for a follow-up CT for ILD. The earlier scan was done in September, but all of these scans were done elsewhere. So for me, it was a fresh scan. And you can see that there are reticular opacities, a little bit of traction bronchiectasis, some ground glass. And so if you look at the unified approach that I've now started adopting, this patient has these three signs here. We know that these are real because they're good quality scans and they're not mimics. The patient was symptomatic, so we know it's an ILD. We know it's fibrotic, and because of the axial distribution, upper mid-zone predominance, a little bit of ground glass, it has a non-UIP pattern. So this is the constellation of findings. But the patient was known to have hypersensitivity pneumonitis, had a full-blown episode a year and a half ago, and now the non-fibrotic component has improved, and this is the residual fibrotic component. But this is not about the ILD. What I wanted to talk about in this case was how I read all of these new scans, and I created a video within a video for that. And so here is how I open up my scans. I have a you see the volume inspiratory on the left, and you have the soft tissue, then the expiratory, then the prone images, and then the sagittal spine, all of which are opened up together. The sagittal spine shows ALL ossification, also shows interspinous ossification, both of which I'm showing with the cursor here. That's the ALL. That's the and it's fine ossification, as if it's just a bunch. It's syndesmophytes flowing up. It's not your flowing ALL ossification that you would get with dish. And then once I've done with that, I can close that, then magnify, look at the soft tissue windows quickly. There's nothing that we're seeing here. And then look at the expiratory images. There's a little bit of patchy air trapping. The prone images in this case are not giving us anything additional. And so then I will go through the lung window images, but we've already described the findings very well here. But in this particular case, I've just widened the windows a little to show you the costovertebral arthropathy that the patient has. And you'll see that there's fusion of the costovertebral joints in the upper and mid spine, and an erosive costovertebral arthropathy in the lower dorsal spine. And you can see the cursor out there pointing that out. Now, to summarize, we have fine ALL ossification, interspinous ossification, costovertebral ankylosis. This is an axial spondyloarthropathy, likely ankylosing spondylitis. The commonest thing we look for and find when we're looking at CT chests in the elderly is osteoporosis and compression fractures, as in this patient. The other thing we see more commonly than axial spondyloarthropathy is dish. So you have flowing ALL ossification, large osteophytes. You may get interspinous ossification here. And this patient has a probable UIP, IPF, and dish. This patient had never been diagnosed with axial spondyloarthropathy. So we called them up and found out, and they said no. And so we've now advised further evaluation because maybe the patient is symptomatic. We weren't able to gauge that, and maybe that would impact the quality of life. So when reading CT chests, especially ILDs in older patients, it is a good idea to look at the sagittal spine as part of the reading protocol, so as not to miss compression fractures, dish, and axial spondyloarthropathy, and then other spine lesions which can impact management. So that was the whole point of this, especially for radiologists who read CT chests. That's the way I do 5 things at the same time. If it's an ILD, obviously if there are no prone images or expiratory images, then you just open the volume inspiratory lung window, soft tissue window, and always the sagittal spine. That's the course. That's my WhatsApp channel. Thank you so much for viewing this.